So I suggest we kick off. It's a great pleasure to welcome you all to this session of the International Seminar on Decision Support After COVID-19. The series is jointly hosted by the Cambridge Judge Business School, Public Health England, and the East of England Population Health Research Hub. It's a seminar series for people who develop models and use their results in the context of the COVID epidemic. And so the specific focus of this seminar series is not just on results, but we'd also like to understand technical details, perhaps key assumptions that underpin models and so on. So please don't hold back technical questions, feel free, we all want to learn. As usual, the seminar will start with a presentation by our guests of about half an hour or so, and then we'll hopefully have a friendly debate amongst all of us on the issues as well as technicalities. Please feel free to make use of the chat facility during the presentation. I'll pull some of the questions from the chat into the later discussion to get us going, or we'll interrupt the speaker if a question requires immediate clarification. So finally, before I leave the floor to our guests, I'd like to remind everyone that this seminar is recorded and that the recording will be published on the seminar website. So without further ado, our guest today is Jean-Philippe Bonardi, who is a strategy professor at HEC Lausanne and whose research focuses on the interplay between business strategy and public policy. And that's of course hugely relevant in the COVID context. Governments across the world try to find a difficult balance between keeping the public healthy and keeping the economy going. And of course, lockdown measures, whether locally imposed or nationally imposed, are a key lever in that battle. So how are they working? This is the topic of today's talk. So welcome, Jean-Philippe, over to you.
Thank you very, very much, Stefan. Thank you very much for the invitation, and thanks all of you for being here. It's a great pleasure, and as you said, a great opportunity to discuss some of what we have done. Let me just also maybe quickly introduce my co-authors who are also in the room. So there's Raphaël Lalive, who is a professor of economics with us at HEC Lausanne. Quentin Galea, who is now a postdoc at University of Zurich and who was with us before, again, at University of Lausanne and in economics. And then Dimitria Kalanovsky, who was also a PhD student before here in Lausanne in strategic management and who is now at University of Manchester. So, I'm just saying that because, if there are some tough technical questions, I guess they will have to pick them up. So that so I want to keep them involved as much as possible. So let me share my screen. The title of our talk is Managing Pandemics: How to Contain COVID-19 Through Lockdown and Releases. Just another word, as you have understood, I mean, we are management and economics scholar essentially. And slightly more, another piece of information is that none of us has really worked on health policy before. What happened essentially, or the history of this paper, is that as everybody else, I guess, in March 2020, we ended up in lockdown, and we started discussing some of these issues, which were basically what everybody was talking about. And then, we started running some ideas about how we could look into this and empirically. And this is basically how the project was born, right? So we really went. We really came into this topic less because of a direct background of things we have worked on before, but more because of what was going on. But the interesting thing is that the more we were thinking about it, the more it turns out that we realized that actually. These pandemics, it's much less about public policy per se, right? Even though we talk about health policy, but it's much more about facing, a phenomenon under uncertainty and adjusting and trying to cope with it, right? And so that's why we came up with this idea that, in fact, when we're talking about how to handle pandemics, it's essentially a management problem, right? And this is why we call the paper Managing Pandemics. So in fact, more specifically, it's probably a management problem under uncertainty. I mean, this uncertainty obviously is related to the fact that, and I guess I don't have to go much on that point, is that, these epidemics and pandemics present major challenges, right, to mankind. They fundamentally disrupt the way economic and overall life is actually being organized. Of course, there is a way that is perceived to be quite effective, and which is certainly effective to handle this kind of thing. And it's actually what in some of the literature, the public health literature, they call pharmaceutical intervention, in which in particular you have vaccines, and you deploy them and you sort of try to solve the problem. But obviously, as we know now, vaccines are more or less, I mean, they can be slow to come up, even though, in that case, in the case of the COVID-19, they've been relatively quick, but they're also not completely easy to implement in large scale. So a lot of the way we are handling pandemics so far, we have been handling pandemics so far, and historically has been actually, again, much more by using sort of managerial movements, if you will, right? So which means essentially figuring out the general posture or strategy about what to do, right? Think about the early discussion about, herd immunity versus more, lockdown intervention and so on. I mean, these things, in fact, nobody really speaks purely about herd immunity anymore. And so, you see how these things evolve. And in fact, when we talk about a management or managerial problem, it's essentially about adopting a mix of measures, sort of empirically, observing a little bit how they work. Sometimes when I say empirically, it can be casually empirically observing how they work. And then flexibly strengthening, weakening them, introducing some new measures, and so on and so forth, right? So that's why basically, this is the way essentially we have been handling the COVID-19, but also how pandemics historically have been handled in a way, right? So if you look at, for instance, examples from history, I mean, quarantine emerged, as one of these, basically measures. Apparently, it emerged during the 14th century plague, the Black Death, during the devastation of Florence around 1350, and it was an isolation of 40 days. Came from the word quarantino in Italy. And then, another measure, just as I picked as an example, is the cordon sanitaire, introduced in France in 1821, where 30,000 soldiers were sent at the Spanish border to prevent the spread of the yellow fever, which was, raging in Barcelona at the time. So, I think that, my point here is to show that, we've been doing that, and this is what we call this managerial problem, introducing some measures and seeing how they work. I'm not completely introducing these two measures casually, in the sense that they've been actually driving somewhat the way we've been thinking about this issue ourselves, right? So you can see here that quarantine is actually a measure to isolate people within a country, right? And so this is something that you might call an internal measure, right, to break infection chains and try to cope with the diffusion of the virus. And the cordon sanitaire is more kind of an external measure, right, that you put in place to isolate a certain territory, right? And so you might call it outside measure. In fact, you will see later when I present a little bit what you have done, we have used actually these two kinds of, or we have used that as a way to sort of organize, right, the way lockdowns were structured in the different countries. So the COVID-19 itself, more specifically, of course, became a reality in early 2020 in China. And again, exactly in the kind of spirit that I was presenting, countries started responding with measures, especially lockdown measures, to reduce mobility and prevent, the diffusion of the virus, but also to try to isolate and protect cities. So again, you can see this kind of, a protection measure versus reducing mobility type of measures. And one of the interesting things is that there's been actually quite a bit of heterogeneity, right? People talk about lockdown as if it was a kind of an homogeneous phenomenon. But in fact, when you look at what countries have done, there is a tremendous heterogeneity around the world in terms of it's kind of a cocktail of measures that have been used, right, in different places. And so this is what attracted our attention and what we wanted to get at, which meaning, trying to categorize some of these measures and look a little bit more at what happened and what they've been combined. And the general questions we've been trying to handle, empirically in this study is essentially, have these measures, that have been implemented in the different countries, have they been, individually and collectively able to slow down the diffusion and the spread of the virus, and also at reducing mortality and death, right? So, and the number of deaths. So really, in the study, empirically, we concentrate on, the spread of the virus, so the number of cases and the growth in the number of cases, and the number of deaths, right? And with the idea of trying to identify what kind of measures, worked better than others. Okay, using actually the variation across countries on that. I've said, that our effort is essentially an empirical effort, which it is, right? So we really went into this really kind of purely empirically, even though, we also had some sort of priors, right? When we started, discussing a little bit this topic, the first priors was that we needed to look at mobility, right? Because mobility within and outside country is actually one of the key factors, right? That basically some of these lockdown measures are trying to get at, right? So we need to say something about this. Second prior is that when you think about this kind of thing, and when you're trying to, in fact, lock down people through different kinds of measures, the way people are going to react, and therefore the effectiveness of these measures, is probably going to be driven quite a bit by the opportunity cost, right, that these people are facing. Meaning that, in countries where essentially, if you already have a job, if you have, some kind of a social insurance and things like that that protect you, the opportunity cost for you of staying home and abiding by the lockdown is certainly lower than in countries where, you're facing much more hardship, or in situation where you're facing much more hardship. And so there's going to be heterogeneity there in terms of countries, or at least, if this hypothesis is kind of, is true, we should observe some differences there, right, in terms of the countries. And you'll see that we try to tackle this by looking at differences across countries in terms of level of development, right? And the idea there is that the more developed countries, probably in these countries, the opportunity cost, of staying home is actually lower, and therefore you might expect that lockdown measures work better than in less developed countries, where it's going to be more difficult for people to abide by this kind of lockdown, right? Again, another prior was that different lockdown measures might have different effects, and that, sometimes we also want to say something about, let's say, the stringency, or, how strict these measures are, right? And so one of the ideas is, of course, to try to see whether, in fact, in some cases, less strict measures might not work as well as some stricter measures, and therefore, that maybe we can potentially relax some of these measures, knowing that, for people in terms of personal or even economic cost, right, this might have a huge impact. We don't look at economic cost at all in this study. We tried to, we wanted to, and in the end, it was kind of difficult to measure, and so we decided to push at least back for some other project, and to concentrate really on this diffusion of the virus and on mortality, right? And looking at differences. Contribution, I mean, I'm not going to go too much on that. I mean, as you have probably, you guys have been looking at quite a bit, and you've had many seminars, so you know that there's been actually a burst of literature, right, on papers and studies, which is of course great, because this is the point, right? Trying to learn together on what is going on, and as fast as possible. And I think there's been a lot of interesting things. I'm not going to cover this literature, but I can say that, or what we believe is actually the contributions of our paper compared to others. That first of all, we're looking at a large number of countries, right, throughout throughout the period, which starts in fact in late 2019 up to August 2020. I'm going to explain why in a second. That's basically, we look at heterogeneity of responses in terms of different lockdown policies across these countries. We also look a little bit at anticipation effect, which is something that basically can have an impact, right, in the way we model and we take into account, what's going on, because you can, for instance, expect that some people might anticipate lockdown measures, right, and therefore, that we might see some surge in the virus and so on, and surge in mobility before actually the thing is put in place. And that in the way we model that thing empirically, we need to have some sort of ideas about, we need to model probably these anticipation effects as well. So we'll show you how we did that. And we also look not only at the lockdowns, but their release, right? And we think it's actually an important aspect of what we do, because obviously lockdowns might have an impact in terms of really pushing down numbers in terms of the growth of the virus. But if, when people are released, things, jump back up right away very quickly, then in fact, we might not have done much, right, with the release themselves, with the lockdown themselves. And so, our paper, we believe, is one of the ones that, start looking at this release period, which is why, we pushed it towards August 2020. So our analysis, in a bit more precise terms, spans 184 countries worldwide, so very large. Basically, we took as many countries as we could. The data set goes from January 31st, 2019 to August 31st, 2020. In terms of the lockdown data, so of course, one of the major aspects of what we do is, and we wanted to collect lockdown data as soon as possible, and to categorize them in a way that would be kind of meaningful. So we did that through, in fact, using computer algorithm and scraping of text analysis, essentially using news data coming from LexisNexis, right, in which we were capturing words that were related to the different kinds of lockdown measures that we could categorize, and I'll get back to that in a minute. And also we confirmed, a lot of the things in particular regarding dates and so on, using the diplomatic service of the USA, which was, providing a pretty complete picture of what was going on, kind of day-to-day updated picture of what was going on. Of course, what was important for us was to identify precisely the first day a measure was implemented. And so a lot of that, we didn't devote only to computer, to the scraping analysis per se, but we did that, a lot of it manually as well, right, for the 184 countries, because of course this first date is critical, right, if we want to say something about the impact of the lockdown on the search of the disease and on curbing the disease. The COVID data itself, I mean, we've followed on that, what was been done by many on this using Johns Hopkins University data, so which provides data about number of cases by country on a daily basis and deaths as well. Of course, even if these guys, I think, have done a tremendous job to putting data out there very, very quickly, there are some reporting issue and some measurement errors, right? And so that's also something we, of course, want to worry about, right, empirically. And then, as I said before, we wanted to test this idea about opportunity cost, looking at differences across countries, in particular, differences in development. And so we used there the Human Development Index, right? And so which we used to actually split the sample into two to look at basically different impacts of the lockdowns. The COVID data, the lockdown data that I was talking about. So again, and this is here, you can see that this is why I was talking to you about this cordon sanitaire and this quarantine. We splitted them essentially into internal measures, which is basically measures that have been adopted within countries to try to again to curb the development of the disease. And you can see here that we identified curfews. We identify when a state of emergency was adopted in a country. And then we decided to actually, instead of, because there were many other things that were going on there. So we decided to aggregate things a little bit there by first looking at two different kinds of lockdown. First, regional lockdowns, in which some regions, were basically isolated, right, within a country, and then specifically, and then partial selective lockdown, in which we gather together here some things related, for instance, to school closures or measures that were basically limiting, the gathering of people in groups, and these kind of measures that have been used in the different countries. So that's for the internal measures. And then we looked at external measures in which, basically the governments were trying to isolate, right, the country from the effect and from the disease coming from other countries. And so there we decided to split this into three. First, what we call selective border closure stage 1, which is essentially, at the beginning of the virus, some countries, in some countries, the virus surged more than others, starting, of course, with China. And so, we isolate first this effect that comes from countries that like Iran also, or Italy, in which, the virus, surged more quickly than others. Then we decided to look at selective border closures of other type of countries that in which, the disease was surging, especially neighboring countries. And then we look at a measure that is more a global measure, which is international lockdown, which is the effective date at which all the country banned all the flights, right, towards other countries. So those are the two things that we did. And you see here that, so we have 7 measures, which are grouped into 2 big groups: internal measures on the one hand, and external measures on the other end. So here is basically a little bit of two graphs which give a bit of a sense for what is going on in the data. So you see here that the A graph on the left look at the day since the first case was recorded in each country, right? And then we look here at the number of measures. The green show inside measure, and the red shows outside measure, right? And you can see here that basically a big chunk of the lockdown measures were actually implemented within the first 30 days, pretty much after the first case was recorded, right? And then on the right, and then that info, in fact, you see the surge of the disease afterwards. And then on the right, you see basically since the 31st of December 2019. And so you see here that what started first were actually external measures, and then basically about 2 months after the beginning of the beginning of the year 2020, basically you see a surge of both external but also quite many internal measures coming up. And as you can see here, as the number of cases and death was also increasing relatively quickly. So regarding the empirical estimation, what we wanted to do is essentially use for each measure, the countries that did not implement the measure as a counterfactual, right, for the ones compared to the ones that were using the measure, right? And so we had the main model was at the DV, in which we consider, in fact, the number of reported COVID-19 cases. In fact, it was a log. We use it as a log, and then we use pretty much the same specification for the number of deaths, right, as what I'm going to show here. In terms of the main variables, so basically, we use the measure variable, which takes a value of 1 after the country. So remember, we have basically daily data, right? So a measure of 1 after which, the measure takes a value of 1 after the country took the measure, the specific measure among the 7 that I was presenting before. We also introduced what we call a time trend data, a time trend measure, which is, we call that days after measure. The intuition there is that, of course, the date of the measure might not be, and there might not be an immediate impact, and so you want to take into account a trend by which, after and a certain number of days after which the lockdown might become effective. And then we have also a measure that we call first, which is basically the days since the first case occurred in the country. So hopefully, obviously, here you can have a lot of problems, right? Empirically that appear in terms of omitted variable bias, reverse causality, measurement errors, and I cannot claim, for sure that we have handled all of them, but at least, we thought about them quite a bit. So in terms of, omitted variable bias here, we introduce country fixed effect and day fixed effect, which we hoped actually capture a lot of the specificity. I mean, country fixed effect in particular are very important because there might be quite a bit of differences there across countries in terms of, the quality of the health system or things like that. And then day fixed effect are also important because things happen during this period in the different countries that we want to, for which we want to have some control. In terms of reverse causality, and maybe I could just switch to just the equation here. It's probably more simple. You can see here that on the fourth line we have we introduce, so we log all the case data, but we introduce this measure here that's called, cases at t-1, meaning that, we try to handle reverse causality by looking at, the number of cases that were in the country at the previous, basically on the previous day, as a way to try to handle, right, this reverse causality mechanism. We have a release data, as I was mentioning, which is basically is taking a value of 1 when the country has been released. And we also introduce some anticipation effects, meaning that, and maybe here, let me just jump here for a minute. So that's basically, if I try to look now at if you look at the data, and if you look at basically the average growth rate of the confirmed cases, right? You can see here basically what the data looks like, right? And you can see here that the point here in B is actually the point where, on average, what happens after lockdown measures were implemented, right? And so you can see here, I was mentioning anticipation because you can see here that there is actually some things happening right before, right, in terms of the surge of the number of cases, right before lockdowns were actually being put in place, right? Which again, indicated for us that we needed to take that into account. And so if I go back to my equation here, and you can see here that this thing sort of happens essentially about a week, right? So 5 days to a week before the lockdown were put in place. So we actually included in the equation here this anticipation dummy, which is basically the dummy for 7 days before, right, the lockdown measure was put in place. And then again, the fixed effects that we were talking about, and then the error term clustered at the country level.
Jean-Philippe, can I ask a quick clarification question?
Sure.
T, is that a date or is it the number of days after the measure?
So that's the date, right? So that's the day at which the measure is implemented.
Okay.
Okay. In terms of developed versus developing countries, again, we wanted to test this idea that maybe there would be differences in terms of development. And so what we did is that, again, we split the sample in two in terms of level of the Human Development Index, and we use that as an interaction term, right, with measures as well as, with days after measure. So again, going back, this is essentially what it looks like. And you can see here right away that, so I talked about the anticipation here, but overall, one of the interesting thing right away is that, I mean, lockdown measures seems to have had quite a bit of an impact here, right? So on the growth of the cases. We try to draw the line here, which is essentially the line that follows the trend, right, that was captured through this surge of the virus, before the lockdown was implemented, before lockdown were implemented. And you can see here that once the lockdown were implemented, actually, we see a clear difference in terms of the development of the disease. So that's the comforting sort of observation about what might be happening there. As I was saying, we were kind of interested very much into what happens in terms of mobility. As I said, mobility is probably one of the key aspects if you believe in the fact that lockdowns are going to have an impact, right? And so we wanted to capture this. And we're also, wondering what was going on regarding this surge and this potential anticipation effect. The first observation is that, and so here, sorry, we used actually Google mobility trend, right, to try to, which, again, we're publishing data and daily data on observation, which allows you to calculate some differences in terms of occupation for different types of activities that people could engage in, right? And so you can see here that we have grocery, retail and recreation, visiting parks, workplaces, residential areas, transit station. And you can see here that for most of them, right? And so the at zero here, we have the day where, again, the lockdown measure, where some lockdown measure was implemented. And you can see here that right away, the impact on mobility is actually quite apparent and quite obvious. Except for residential areas, meaning that probably people that are now locked into some more residential areas, and so here some of the things there was more movement there, but basically for most of them mobility was actually decreasing when lockdown were implemented. On the other end, contrary to what we were sort of expecting, we don't see a ton of evidence that there was actually a big anticipation effect, right? So again, with this idea of anticipation effect, we were sort of expecting that people would sort of go out, right? And for instance, for grocery and pharmacy, for instance, right? And would basically do that a whole lot. You can see a little bit of difference here, but definitely not something that is really massive there, right? So again, on this anticipation aspect, it's probably not super convincing, what is going on there regarding mobility, but at least it gives us some comfort in the idea again that some of the things that we are going to observe and that we have been observing in the previous slide regarding the impact of lockdowns actually has to do with a reduction of mobility, right? Which again was kind of the goal, right? And it's kind of the goal in terms of breaking infection chains in this lockdown episode. So here is basically, here is basically some of the key results, right, that we get at when we estimate the models. So here we're looking at marginal effects on the growth rates of COVID-19 cases, right? So basically comparing, again, countries that have been implementing the measures versus countries that did not. And you can see here on top that we've been basically, again, grouping things, again, with the same intuition that has been driving us from the beginning, which is, this kind of internal or within country measures versus measures towards the outside, right? And so you can see here right away that the first interesting implication the first interesting result there is that within country measures, seem to have a stronger impact than the measure towards the outside, right? So we have extrapolated here with measures towards 100 days, right? And you can see here that the measure after 100 days have essentially decreased the growth rates of the number of cases of COVID cases by essentially 10%, whereas actually, it's much less when you're looking at outside, so meaning basically closing borders and things like that. And so, if you look at here again on top, if you look at the blue ones, on top you have again internal measures, and down part you have again these external measures, right? So if you look at internal measures again, you can see that actually most of them, whether you talk about state emergency and curfew, that here for this slide, we put them together because they were essentially having similar results. And then again, within country regional lockdown and partial selective lockdown basically have roughly the same impact, meaning that, for all of them, we get to around this 10% impact and decrease on the growth of the cases. This is actually quite interesting as a result as well. I mean, we think in the sense that Of course, partial lockdowns are much less harsh and tough on people, on economies, and so on, than things like such as state of emergency and curfew, or even within country lockdown. Regional lockdowns, right? So it's actually interesting that it gives some ideas, even though it's not very clearly measured here, but it gives some ideas here that actually, you can go with for some of these partial lockdown, closing some areas and so on, within region, within cities, is pretty much as effective as much more stricter measures, such as, state of emergencies and curfews, for instance, right, which have been implemented in some countries. So again, it's not very clear at all in that case that stricter measures have a much deeper impact, right, on the growth, on what is going on in terms of the ability to curb the spread of the disease. And again, if you look at the impact of outside measures, right, or what we call, external measures, you can see here that again, basically they are basically barely significant or not significant if you look at border closures stage 1 and stage 2, right? And if you look at strict international lockdown, which again are very strict and very confining or relatively strict measures, they have an impact, right? But again, it's an impact that is actually and remains lower than what we have seen for internal measures, right? Again, clear message there is that internal measures were quite effective, all with basically a reduction of 10% on the growth after 10 days, after 100 days, and not clear that stricter measures were more effective. And external measures seem to be less effective, certainly less significant. And even if you look at the most stricter measures, you get to actually 8.9% reduction of the growth rate after 100 days, which again is lower than what we've seen with internal measures. If you now look at what we have done regarding mortality, so again, we run similar models, but trying to look at in that case, the death rate, right? Number of cases in terms of death, in terms of instead of cases of the disease, then in fact you see something that is a relatively similar message. Of course, as you can see here. So maybe, sorry, what I didn't say is that before we could see a curve, and a clear curve in the growth rate by basically 2 weeks with internal measures. You can see here that when we talk about the mortality, you talk more about something like 2 months, right, to get to the 0% growth rate. But again, same message in terms of the comparison between internal measures and outside measures. Outside measures, take a longer time, right? A much longer time in terms of getting to the 0% there, and so it seems to be actually less effective again on the death than internal measures. And again, relatively similar measure there, similar impact there of what we were saying before in terms of internal measures. And again, partial measures seem to do the trick and seems to have a relatively similar effect than stronger measures in terms of a state emergency curfew or even regional lockdown. And then international lockdown works. So again, remember on death, remembering that it's something that is relatively strong, but our 2 other measures of border closure again takes more time to actually get to converge right towards the 0%. Of course, when you look at death, there is an exercise that is, of course, interesting and tempting to do, which is trying to quantify, right, how much death we have been able to avoid because of lockdown. So we tried to do this. We tried to go into this. Of course, it's a very challenging thing, and so we need to take that with a big grain of salt, I guess, right? Because the question there is, what is really the counterfactual, knowing that basically you have a lot of death, going on in all the countries, and so it's not completely clear exactly how it works. What we did is that we used, the same curve as I was showing before, and we were extrapolating behaviors, right, after the implementation of the measures, and we were comparing with actually the actual behavior, right, what was going on. When we did that, what we did is that we calculated a ratio of prevented death to actual death. And this ratio basically in our models ended up being around 5, right? Meaning that there's somewhat more than 5 deaths that were prevented per every death that occurred, right? And so, at the end of the sample, at the end of August, in developed countries, we have a total of, 1.3 million confirmed deaths. So if you follow this kind of quick and dirty attempt to quantify, this means that, lockdown would have basically prevented something like 5.5 million deaths in developed countries. Talking very quickly, because I'm just looking at time here. I'm taking, sorry, Stefan, a bit more time than I thought. But so again, as I told you, what we did is that we splitted the sample in 2 types of countries based on Human Development Index. And you can see here that we did the same exercise. We compared marginal effects. So on top in red, in red, you have what happens for developing countries. And again, you see the same measures in blue for developed countries. And so the message here overall is very, very clear, which is that essentially what we have observed and most of the effects that I was showing before are driven essentially by what's going on in developed countries, right? We pretty much observe nothing for developing countries for the different lockdown measures, right? So it's probably one of the important results, I guess, even though this needs to be, certainly refined and thought further and discussed. But one of the strong results there is that it seems that actually the lockdown measures have had very little impact, right, on in developing countries, which again, might be related to the argument that I was presenting before, which is that, the opportunity cost of for people of staying home and abiding by these lockdown measures might be way too high in these developing countries, in which case, which might be explaining why we observe this. Studying quickly the lockdown measures, again, we have to be relatively cautious there because, the counterfactual is relatively difficult to find, right? As again, most countries were still in lockdown in May, right? In fact, originally, right, we had collected data up to mid-May, and then we extended up to mid-August, in particular because we wanted to capture, right, this release. You can also think that 3 countries that released first were actually the ones that did better at controlling the virus in the first place, and so there might be some endogeneity problem there. But that taken into account, we basically drew the same graphs as what we did there, but now looking at the release, right, of the measures. And you can see here that overall, the important result is that if you look at the different measures, whether they are actually internal or external ones, most of them don't seem to lead to a very strong surge, right, again, of the virus after the release, right? The one that basically seems to be leading to the strongest type of increase or the strongest impact on the growth is actually the release of the border. So some release of the border number 2, which is again the release of the border for a selective number of countries that were typically neighboring countries for the countries that implemented the measure. And so you can see here. So interestingly, there seemed to be some indication that some of these external measures now matter a bit more when you release. But overall, these results are, let's say, mildly encouraging in terms of, again, the efficiency of the lockdowns, if it's, the main purpose of what we are trying to do here, in the sense that, even after, a while, they don't seem to be leading to a very, very strong surge, specifically each lockdown measures to a strong surge of the virus. We've been doing some additional analysis in terms of first looking at the sequencing of the measures. And in particular, we wanted to see whether, when you do external measure first versus internal measure first, whether this had an impact. And what we found is that actually external measures work better once internal measures have already been put in place, right? So, which, is interesting because, again, as I was showing before, external measures don't seem to have a very strong impact in what we were looking at before. We've also been trying relatively hard to look at timing and whether, the countries that, reacted first. So we look at the first quartile of the countries, for instance, and whether there was a very clear difference there. And we found something, so some indications that this is happening, but not very clear, and nothing that was super completely obvious in terms of a first mover advantage there in terms of implementing these lockdown measures for any of the measures that we looked at. So interpretations, and then I'll go very quickly on that, is that the key measures seem to be what we call the key measures to stop the development of the disease seems to have been local or within country lockdowns rather than external lockdown and containment measures. There seems to be some decreasing marginal benefits there in terms of saying that, it's not very clear that when you adopt very or much stricter types of internal measures, such as, again, curfew and so on, you really get much better. So in our estimation, it seems that, what we have called partial lockdowns, such as, closing schools and closing some areas in which you might expect the disease to be developing, it seems that those have actually are as effective. And of course, these are actually probably, as I mentioned before, already less costly in terms of, economic cost, psychological cost on people and so on. They're also a bit less costly to enforce, right? So there is something that is potentially interesting there in terms of, again, how we run these lockdown measures. And in the release period, again, it seems that, there's none of the measure being lifted leads to a very strong surge of the measures. When it comes to external measures, they seem to be less effective. And so, we can discuss a little bit why it is like that. Might be that countries have started too late, and at that stage, again, the external measures are no longer effective. But it's not very clear that this is what's happening, because, again, we don't see much of a first mover advantage even for external measures in what we have tried to observed. External measures bring some benefits, but once internal ones have played out, right? And there is some indication that seems to indicate that, again, opening borders might play a bit more of a role in the release period, but again, not very clear. So overall, I mean, I think that, there are some positives there in terms of the fact that lockdown seems to have had an impact both on the growth of the virus and number of cases and on death. Again, internal working better, but of course, there is this caveat, which is that, what we don't observe this in developing countries, which certainly raises some questions there about what is going on. And again, might be an explanation in terms of opportunity cost, as I was looking at before. Of course, what is interesting is that, there's been some discussion about alternatives to lockdown, and we have not studied that empirically at all. But, contact tracing, for instance, seems to be orders of magnitude more cost efficient. However, they haven't seemed to work so far, right? Much in terms of acceptation and so on. So it's not clear actually that, they could replace anytime soon, what we've been able to discuss, what we've been able to do regarding lockdown themselves. And so I'll stop on that. Thank you very much.